movements in fascia. First of all, we talk about the pelvic diaphragm. The pelvic diaphragm is formed by the levator ani muscles. So first let's do the levator ani muscles and then we move on to the pelvic diaphragm. So the levator ani muscles are broad, flat muscles, the fibers of which pass downwards and inwards. Okay, now let's see. The levator ani is made of puborectalis, pubococcygeus, and iliococcygeus. Sometimes they also include another part of the iliococcygeus, namely the ischio-coccygeus. But here we're going to focus on the three parts here that make the levator ani: the pubococcygeus, the puborectalis, and the iliococcygeus. So this is the pubococcygeus. It starts all the way from the pubis to the coccyx. So pubococcygeus, then puborectalis, from the pubis to the rectum, and then the iliococcygeus from the ilium to the coccyx. Now, the two muscles, one on either side, constitute the pelvic diaphragm. So these muscles have one part on each side. The muscles arise by linear origin from the following points. The first point of the levator ani muscles is the origin, is the lower part of the body of the os pubis. So you can look at the levator ani here, and we can look at the lower part of the body of the os pubis here. Do you remember the bones of the hip bone? So we have, this is the superior pubic rami, this is the pubic body, and this is the inferior pubic rami. So the first part of the origin of the levator ani muscle is the lower part of the body of the os pubis, the lower part of the body of this os pubis. The internal surface of the parietal, the internal surface of the first part we've done, the first part of the origin of the levator ani muscle is from the lower part of the body of the os pubis. The second origin is the internal surface of the parietal pelvic fascia along the white line. Now here can you see the parietal pelvic fascia, and this is the white line of the parietal pelvic fascia. This is the second origin of the levator ani muscle. The third is the pelvic surface of the ischial spine. So this is your ischium, and this is your pubis, and this is your ilium, right? So let's look at the ischium spine here. So this is the ischial spine. So the third origin of the levator ani muscle is the pelvic surface. By saying pelvis, I mean the posterior surface of the ischial spine. Now the levator ani muscles are inserted into 4 points. Wait, not 4 points. They're inserted into 1, 2, 3, 4, 5, 6 points. Crazy. Okay, so the first insertion is the preanal raphe and the center point of the perineum, where one muscle meets the other on the opposite side. So let's find the preanal raphe. So this is the preanal raphe, where the coccygeus part of the levator ani is inserting. So this is the first insertion of the levator ani, the preanal raphe and the center point of the perineum, where the one muscle meets the other on the opposite side. Can you see that one muscle is meeting the other on the opposite side? These are all the levator ani muscles, right? The second insertion is the post-anal or anococcygeal raphe, where one muscle meets the other on the opposite side. This is the post-anal or anococcygeal raphe, where one muscle is meeting the other again. Now the third part is the lower part of the coccyx. Can you see that at the lower part of the coccyx again the levator ani is inserting? Now we're going to see the muscle as two parts. The muscle is mainly divided into two parts. Sometimes they divide into three, sometimes divided into four, but the two main parts are the pubococcygeus and the iliococcygeus. Now the pubococcygeus arises from the from the pubis part up until to the coccyx. Now, what is important to know is that the pubococcygeus muscle, I'm going to show it to you here. Pubococcygeus here. Can you see the pubococcygeus muscle here? This is one half of the hip bone shown to you. This is the pubococcygeus. This is the iliococcygeus. Sometimes they divide it into ischio-coccygeus also. So the pubococcygeus muscle supports the pelvic and abdominal viscera, including the bladder. The medial edge passes beneath the bladder and runs laterally to the urethra, into which some of the fibers are inserted. So the medial edge of the pubococcygeus basically passes beneath the bladder and runs laterally to the urethra. You can see that here. and then inserts into the fibers of it, into which of some of the fibers in the urethra, some of the fibers of the pubococcygeus are inserted. Then we have the I also wanted to say that the medial borders of the pubococcygeal muscles pass on either side from the pubic bone up until to the preanal raphe. Okay, so they start from they pass on either side from the pubic bone up until to the preanal raphe. They embrace the vagina and on contraction have some sphincteric action. The nerve supplies from the third and fourth sacral nerves. This is very important. The nerve supplies from the third and fourth sacral nerves. Now, together with the fibers of the opposite muscles, they form a loop that maintains an angle between the posterior aspect of the urethra and the bladder base. During micturition, this loop relaxes to allow the bladder neck and upper urethra to open and descend. Let's come back to the pubococcygeus and ileococcygeus for just a second. Remember that the pubococcygeus, they're calling it puborectalis here, the levator ani, but it's also pubococcygeus. The pubococcygeus arises from the pubic bone and the anterior part of the tendinous arch of the pelvic fascia. I told you. Let me show that to you. This white line, remember that white line of pelvic fascia. So the pubococcygeus comes up from the pubic bone and the anterior part of the tendinous arch of the pelvic fascia, this white line. And the ileococcygeus, on the other hand, if I can see it here, not really. I'm going to show it you in a different picture. The ileococcygeus arises from the posterior part of the tendinous arch and the ischial spine. So this is the ischial spine. This is the ischial spine. The ileococcygeus coming up from the posterior part of this tendinous arch and this ischial spine. Okay. The medial borders of these pubococcygeus, we said, pass on either side of the pubic bone to the preanal raphe. They thus embrace the vagina and on contraction have some sphincteric action. The nerve supplies from the third and fourth sacral nerves. The pubococcygeal muscles support the pelvic and the abdominal viscera. So these pubococcygeal muscles basically support the pelvis and the abdominal viscera, including the bladder which sits on top, right? The medial edge passes beneath the bladder and runs laterally to the urethra here, into which some of its fibers are inserted. Together with the fibers from the opposite side, they form a loop and maintains the angle between the posterior aspect of the urethra and the bladder base. During micturition, this loop relaxes to allow the bladder neck and upper urethra to open and descend. Now we look at the urogenital diaphragm. Before we move on to anything else, we should see we have the pubic symphysis, and then the coccyx here, and then the line, imaginary line joining the two ischial tuberosities, and the ischiopubic ramuses on either side on the anterior part. We divide this entire perineal space into two triangles. There's a urogenital triangle and then there is an anal triangle. When we talk about the urogenital triangle, we have something called as the urogenital diaphragm. There's a superior fascia of the urogenital diaphragm and there's an inferior fascia of the urogenital diaphragm. It's a deep space that's basically enclosed by two layers, superficial fascia of it and the inferior fascia of it. So the urogenital diaphragm, also known as the triangular ligament, it's made of two layers of pelvic fascia that fill the gap between the descending pubic rami. This is the ischiopubic ramuses that are descending, the descending pubic rami, and lies beneath the levator ani muscles. The deep transverse perineal muscles, which is the deep transverse perineal muscle, which is also called as the compressor urethra, lie between the two layers, and the diaphragm is pierced by the urethra and the vagina. So this diaphragm is pierced by only two things: the urethra and the vagina. And the urethra was enclosed by the deep transverse perineal muscle, and that deep transverse perineal muscle lies between these two layers of superficial fascia and inferior fascia, right? And it basically, this entire diaphragm lies beneath the levator ani muscles that we just studied. We now move on to the perineal body. Let's look at the perineal body. This is the perineal body, the perineal membrane, the ischiorectal fossa, the coccyx, anococcygeal body, anal canal. So what is the perineal body? This is a mass of muscular tissue that lies between the anal canal and the lower third of the vagina. Its apex is at the lower end of the rectovaginal septum, at the point where the rectum and posterior vaginal walls come into contact. Its base is covered with skin and extends from the foreshaft to the anus. It is the point of insertion of the superior perineal muscles and is bounded above by the levator ani muscles, where they come into contact in the midline between the posterior vaginal wall and the rectum. That's your perineal body. Right, so it's a mass of muscular tissue, lies between the anal canal here and the lower third of the vagina. We can imagine the lower third of the vagina here. Its apex is at the lower end of the rectovaginal septum. So basically the anal canal is at the back, so the rectum is at the back, and in the front it has the lower third of the vagina, right? So obviously in between these two you have the rectovaginal septum. So its apex will be at the lower end of the septum, at the point where the rectum and posterior vaginal walls come into contact. Its base is covered with skin and extends from the foreshaft to the anus. It is the points of insertion of the superficial perineal muscles and is bounded above by the levator ani muscles, where they come into contact in the midline between the posterior vaginal wall and the rectum. Now we come on to the pelvic peritoneum. The pelvic peritoneum is basically reflected from lateral borders of the uterus. So can you see these mesosalpinx, mesovarium, mesometrium? All this is the part of the pelvic peritoneum. It's reflected from the lateral borders of the uterus to form on either side a double fold of perineum. This is all called the broad ligament. All this yellow part is called the broad ligament. Okay. Despite the name, this is not a ligament but a peritoneal fold, and it does not support the uterus. Now, the fallopian tube runs at the upper free edge of the broad ligament. Why is it the free edge? Because on one edge there is no broad ligament, so one edge is free. As far as the point at which the tube opens into the peritoneal cavity. Here the tube is opening into the peritoneal cavity. The part of the broad ligament that is lateral to the opening is called the infundibulopelvic fold. So here we have the infundibulopelvic fold. Okay. And in it the ovarian vessels and nerves pass from the side wall of the pelvis to lie between the two layers of the broad ligament. So here you have the ovarian vessels and nerves that are lying between the two layers of the broad ligament. The mesosalpinx, as you can see here, the mesosalpinx the portion of the broad ligament that lies above the ovary, is layered. Between its layers are seen any Wolffian remnants that may remain. Then we have below the ovary, the base of the broad ligament widens out. This below the ovary, this base of the broad ligament basically widens out. You can see it's widening out here, and contains a considerable amount of loose connective tissue called the parametrium. So there's some loose connective tissue here which we call the parametrium. The ureter is attached to the posterior leaf of the broad ligament at this point. So at this point, the ureter is attached to the posterior leaf of the broad ligament. The ovary is attached to the posterior layer of the broad ligament by a short mesentery, the mesovarium. So here the ovary is attached to the posterior layer of the broad ligament by a short mesentery, which we call the mesovarium, through which the ovarian vessels and nerves enter the hilum. The ovarian ligament and round ligament now. Let's look at that because it's very important. Now we look at the ovarian ligament and the round ligament. Okay. So the ovarian ligament lies beneath the posterior layer of the broad ligament and passes from the medial pore of the ovary. Here you can see it's passing from the medial pore of the ovary to the uterus just below the point of entry of fallopian tube. So this is your ovarian ligament, which basically lies beneath the posterior layer of the broad ligament, passes from the medial pole of the ovary to the uterus just below the point of entry of the fallopian tube. Then we have the round ligament. Here you can see the round ligament. The round ligament is the continuation of the same structure and runs forward under the anterior leaf of the peritoneum. Okay, it runs forward under the anterior leaf of the peritoneum to enter the inguinal canal, ending in the subcutaneous tissue of the labium major. The round ligament is the continuation of the same structure and runs forward under the anterior leaf of the peritoneum to enter the inguinal canal and ending in the subcutaneous tissue of the labium major. I am going to show it to you here. Can you see the round ligament here? So this round ligament is the continuation of the same structure and runs forward under the anterior leaf of the peritoneum. Here it runs forward and enters the inguinal canal here, ending in the subcutaneous tissue here of the labia majora. The pelvic fascia and pelvic cellular tissue basically is the connective tissue that fills the irregular spaces between all of these various pelvic organs. Now, just as something about the pelvic loose connective tissue. Much of it is loose cellular tissue, but in some places it is condensed to form strong ligaments that contain some smooth muscle fibers and which form the fascial sheaths that enclose the various viscera, the pelvic arteries, veins, lymphatics, nerves, and ureters run through this pelvic tissue. Cellular tissue is continuous above with the extraperitoneal tissue of the abdominal wall, but below it is cut off from the ischiorrectal fossa by the pelvic fascia and the levator ani muscles. This is it. Let's stop here and continue with the blood supply and lymphatics in the next video.